Hi students, and welcome to week 1 of Medical Terminology 2. So today we're going to be talking about the respiratory system and the medical terms associated with it. Okay, sorry. So what I want to be sure is that we commit the respiratory system prefixes, suffixes, and word parts to memory to enhance your medical terminology vocabulary. So we're going to look at the word parts and have word parts in the example or either the definition. So bronch and bronchi refers to the bronchial tubes or bronchus. The larynx refers to the larynx or throat. Nase refers to nose. Ox, oxy is related to oxygen. Pharynx is related to the throat or the pharynx. Phono is related to sound or voice, and then plural is related to plural inside a body. Then we have pnea, which is breathing. Pneum or pneumon, which is lung or air. Sinus means sinus. Som means sleep. Sphere, to breathe. Thorax or thorax means chest or pleural cavity, and then trachea means windpipe. So one of the things I want you to be familiar with is learning how to pronounce the words. And one way to do this is to use your phonetic spellings, which are in your textbook. So make sure to use those to help you to sound out the words. So we're going to look at a few medical terms and a few tips. And the medical terms here highlight some of the word parts that we looked at a little while ago. So the first one is anoxia, and it is the absence of oxygen from the body's tissue or organs despite an adequate flow of blood. And so you see the OX in anoxia and how it is related to the word oxygen. Asphyxia is the loss of consciousness that occurs when the body cannot get the oxygen it needs to function. And so again, you see, so when we see the word asphyxia, the loss of consciousness that occurs when the body cannot get oxygen it needs to function, that just means that the body is unable to breathe like it's supposed to. Then we have the word atelectasis, which is incomplete expansion of part or all of the lung. Bradypnea or bradypnea is an abnormal slow rate of respiration, usually of less than 10 breaths per minute. So it just kind of shows that the patient is not breathing as fast as they should. In fact, it's very slow. Bronchorrhea is an excessive discharge of mucus from the bronchi, and then bronchoscopy is a visual examination of the bronchi using the bronchoscope. So you can see the word bronchi being used here and referring to that part of the lung. So tip number 1 is to memorize the meanings of the prefixes and suffixes of word parts for the medical terminology. So that's rule number 1. Some other respiratory system terms are endotracheal intubation, which is the passage of a tube through the mouth into the trachea to establish or maintain an open airway. And a lot of times, if you're studying to be a coder, you'll see this term used a lot, endotracheal intubation, and sometimes it's shortened to refer to as a trach given to a patient who's having a hard time breathing. Then the next word is epistaxis, which is bleeding from the nose or a nosebleed. So you may have experienced that yourself or maybe your child. So one thing I would like for you to do is to begin practicing using the medical term instead of the lay term. So that would give you help you to even further develop a vocabulary. Hemoptysis is the expiration of blood or blood-stained sputum. A lot of times people are coughing up blood, which is what hemoptysis is. So you'll see that a lot of times in signs and symptoms when you're reading the patient's chart. Hypercapnemia is the abnormal buildup of carbon dioxide in the blood. So here we see pnea, referring to breathing And then hypernemia. Hyperponemia is breathing that is deeper and more rapid than is normal at rest. So the word hyper meaning high, and then nia referring to breathing. And then we see hypoxemia, which is a condition of having low oxygen levels in the blood. We see the word hypo meaning low, xemia meaning breathing, and then emia, the emia part, I'm sorry, the ox here is oxygen and the emia part is blood. So tip 2 is to create flashcards for each body system and review them often. When I was in school, I would take my flashcards with me all the time. When my friends were going to the mall, I would grab my flashcards, study them in the car, and then once we got to the mall, I put them up, and on the way back, if it wasn't dark outside, I would continue to study those. So the flashcards are really important to have because you can pull them out and study in your downtime. Next medical terms we're going to look at is laryngectomy, and this is the surgical removal of the larynx. Ectomy means the removal, and then we know larynx is. Nebulizer is an electronic device that pumps air or oxygen through a liquid medicine to turn it into a mist that is inhaled via face mask or mouthpiece. A lot of times if you're watching the medical shows, you'll see people as they're getting put into the ambulance, they always have something that's put over their nose and mouth. More than likely, this is a nebulizer that they're using to provide the patient with oxygen. And then we have the otolaryngologist, which is sometimes referred to as an ENT doctor, but they specialize in the treatment of disease and disorders of the head and neck. Pharyngitis is the inflammation of the pharynx. So here you see itis, which it means inflammation, and then of course the pharynx. Pneumocanosis is a fibrous lung tissue caused by dust in the lungs after prolonged environmental occupational contact. During the 911 disaster, a lot of first responders came down with this condition. And then we have the pneumothorax, which is the accumulation of air in the pleural space resulting in a pressure imbalance that causes the lung to fully or partially collapse. So you'll read about that a lot. If you're studying to be a coder, you'll see pneumothorax referred to a lot of times in charts. So tip number 3, the best time to study is just before going to bed. Here you are finished with your day and your mind is much calmer. I found that to be true when I was studying my medical terminology. One of the things that I would do is just before I got ready to go to bed is I would pull out my flashcards and begin to study my words. And even after, reviewing the flashcards, I would lay in the bed for a little while before dozing off to sleep and recall those words. So it's a better time to learn is at the end of the day. Other terms, tachypnea, which is an abnormal rapid rate of respiration, usually of more than 20 breaths per minute. So you see the tachy, you probably learned that in your last medical terminology class, that means fast. And then pnea, of course, refers to breathing. And then thoracentesis is the surgical puncture of the chest wall with a needle to obtain fluid from the pleural cavity. And so you can see what the thoracentesis is referring to what part of the body? The thorax. And then finally, tip number 4, practice makes perfect. Practice pronouncing your medical terms daily. I cannot stress that enough. The more that you say those words out loud, even over and over, the same word over and over again, so that you can gain command of that particular word pronunciation. So thank you, and I will look forward to talking to you again next week.